The businessman Shonisani Lethole was not offered food for over 100 hours during his stay at the Tembisa Tertiary Hospital. All part of findings released by the Health Ombudsman, Professor Malegapuru Makgoba. The findings are part of an investigation into the circumstances surrounding his death. He had been admitted to hospital with breathing difficulties. The businessman took to Twitter at one point to reach out to the Health Minister, Dr. Mkhize, regarding conditions at the hospital. It is a disturbing story. It leads the bulletin, and I'm joined now by reporter Masego Rahlaga. So, Shonisani Lethole practically starved at the hospital during his stay. That's disturbing enough. What else did the Ombudsman say?
Well, Jeremy, it just is a story that really reminded me of the Health Ombudsman releasing that report into the deaths of 144 psychiatric patients at Life Esidimeni. Shonisani Lethole went to the Tembisa Hospital to be admitted on the 23rd of June last year. He was displaying severe symptoms of COVID-19. He could not breathe, for instance, Jeremy. What the Health Ombudsman, Professor Malegapuru Makgoba, found was very disturbing in terms of the fact that he says that, for instance, a professional doctor only went as far as actually looking at the report into Shonisani Lethole's tests and the x-rays that they took of his chest after his death. So during the time that he was at the hospital, between the 23rd and the 26th, there was no professional or a clinician or a doctor that came to see him for 3 days. So that is why one of the staff members told the investigators from the Health Ombudsman's office that the death could have actually been avoided. The other disturbing thing, Jeremy, about the food part of the investigation was that he was not fed for or offered food for about 43 hours, 24 minutes after his first admission. Then they gave him food after those 43 hours. After that, he was starved again for 57 hours and 30 minutes. The other disturbing point of this investigation, Jeremy, was the fact that the health staff, while they were being interviewed, didn't know when Shonisani passed away. There was a group that said he passed away on the 27th, another group that said he passed away on the 28th, but he was certified dead on the 30th. We now know that he died on the 29th, and the Health Ombudsman had to go as far as reaching out to Telkom for them to find out when last the hospital contacted the family so that he could jot down that date as the date of death. But here is the Ombudsman with just part of the damning 202-page report against the Tembisa Hospital.
He was not offered food at Tembisa Hospital for 100 hours and 54 minutes. And this came in two tranches. The first was for 43 hours, 24 minutes. The second was for 57 hours and 30 minutes. The first failure to offer him food was when he arrived at the hospital on the 23rd to the time when he got admitted to Ward 23 on the 24th around midnight, when he started to have food the following day. And he declared to everybody that he has finally eaten at Tembisa Hospital, and that time he was in Ward 23.
It takes your breath away. It's nothing short of a national disgrace. What more was revealed about the staff then who were treating him?
Well, what was revealed, Jeremy, was this point that was made by the Health Ombudsman about the management and the staff at the hospital withholding information. So between the 23rd and the 26th, none of the staff members really knew whether or not Shonisani Lethole was fed. But now we know that he wasn't. But they were telling the previous health MEC, Dr. Masego, that he was indeed fed. But it's been found that he wasn't, and they withheld some information. Something else that was found, Jeremy, was the fact that he had been brought food by his family at some point, but he wasn't given that food. So that's just some of the findings that were made by the Health Ombudsman as well as his staff. But he is again, Jeremy, about wanting 19 staff members at the Tembisa Hospital to be put through a disciplinary process.
So between the 27th and the time of his death, Mr. Lethole was to be fed. But the hospital withholds that information from the public. It's as if the journey ended on the 27th, but they don't want to talk about the 7th, 28th, and 29th, when he was alive, they would have demonstrated that they didn't give him food like they've shown there, that between the time when he was in Ward 23 and intubated, he received food. But after that, he was still in Ward 23 until he died. He was supposed to receive food. He never received food.